Hello and welcome to Health Tech Builders. Here we explore the business of health innovation through real stories from leaders in the trenches, the wins, the failures, and everything in between. You will get insights and practical advice to help you build and lead in health tech. I am your host, Rodrigo Hute. Hello, everyone, and welcome to the podcast. Today, I have a very special guest. Today, my guest is Dr. David Rabin. Dave is a renowned neuroscientist, also a psychiatrist, and he has spent over a decade studying stress, anxiety, PTSD, and many other areas in mental health. He is also the co-founder of an amazing company called Apollo Neuroscience. This is a wearable health technology that actively improves energy, focus, and relaxation. Dave, thank you so much for making the time and for being here. Welcome to the podcast.
Thanks for having me, Rodrigo. It's a pleasure to be here with you.
Yeah, so today we're gonna be talking about stress, anxiety, the science behind stress. We're gonna be talking about psychedelics. And also, we're going to be talking about Apollo Neuro, an awesome wearable technology that I'm looking forward to try myself. But let's start with the basics, Dave. And you have said many times before, and I've been following your work, and you've said that stress is inevitable, but suffering is optional. And that really caught my eye, and I just wanted to start there, and ask you, what is stress really? What is the difference between stress and anxiety, and what do you mean by that suffering is optional?
Yeah, that's a great place to start. So stress is really another word for challenges that we face in our lives. So challenges could be anything from getting up in the morning, going to work, making yourself food, learning a new thing, or it can be something that's like a much higher degree, like something that's borderline a traumatic event that happens in your life. And interestingly enough, so I've spent about actually closer to 20 years studying chronic stress and the impact of stress on the way we make meaning from our lives and the way that we adapt. And really with the goal of trying to figure out what separates folks who get sick from stress versus folks who excel and grow from stress. And the best examples of these two different groups are people like elite athletes and artists and people who have really excelled to the peak or near the peak of their human potential to do things that we never thought possible as humans. And then on the growth side, and then on the other side, people who suffer from chronic stress and stress of different kinds that results in severe mental illness. And one of the most interesting things that I've learned over the last couple of decades of studying and working with these folks in the clinic and in the lab is that the way we interpret stress, whether it's stress under safe conditions where we don't believe ourselves to be physically under survival threat or potentially being physically harmed, is very different than when we perceive ourselves to be potentially under physical threat or harm. And whether or not we believe it to be our fault that we're stressed or struggling with challenges, or whether it's just part of life. And so this is what we call perspective. And the perspective that you approach a stressful event with has altogether to do with whether or not we grow from it to achieve a higher level of our human potential, or whether we get sick from it. And the best example of this is to say, or to think about, when you are experiencing stress or challenge, do you first ask, why me? Like, why am I faced with this challenge? And what's wrong with me that I am so challenged all the time? Or do you ask first, how do I grow and what can I learn from this experience? And it's just asking these simple questions and asking the right questions, which the right question in this case is, what can I learn from these experiences? How can I grow from these experiences? Where you start to look at stress as stressful moments as an opportunity for growth and expanding our human potential, that we translate stress, what we call bad stress or distress, into that makes us sick, into eustress, EU stress, or good stress that helps us grow. And so that's kind of the basic breakdown. And eustress or good stress has a positive impact on our nervous system in that it increases our nervous system's ability to adapt to stress. One example would be like sauna cold plunge, like hot cold, right? And that's a stress where we're safe, but it's uncomfortably safe. And we're not going to harm ourselves, but it's not always that comfortable. But going through that trains the body to be more resilient to stress. Whereas other kinds of stress that makes us ask questions or triggers us to ask questions like, why me, actually shifts that stress into more of a detrimental, disease-based type of stress. And so our perspective really matters when we think about how we approach stress in our lives.
So you're saying that it's all about perspective and framing stress in the right way if it's not dangerous. So we can train ourselves to see stress and anxiety in a positive light. Is that basically what you're saying?
Yeah, stress specifically. Anxiety is different. Anxiety is so stress when we're safe, if we're physically safe, and by physically safe I mean we're not being chased by a predator, we're not running out of food, water, or air, and there's no risk of being like excluded from your community, right? Those are like the five, or losing lots of sleep over time. Those are like the 5 or 6 major triggers that make us believe that a stressful situation or a challenge we're facing is actually threatening to us. And if we're not checking off any of those 5 or 6 boxes, then the stress we're facing is a growth opportunity. And so the reason why and this goes back to ancient Buddhist traditions in terms of and other ancient Eastern and tribal traditions about suffering being avoidable, is that suffering is the resistance to what is happening. So when you push back on what's happening rather than just going with the flow, as Bruce Lee said, like be like water, right? Like when water enters a cup, it becomes the cup. When water enters a stream, it becomes the stream. But if you try to push back on the stream, then the stream will wash over you and wash you out, right? And that resistance to what's happening, and by asking the wrong questions, like the why me questions, or what's wrong with me that I am facing this challenge right now, transmutes stress as a growth opportunity into distress as a potential disease-provoking event that can induce illness and dysfunction in the body. And that triggers our stress response, the sympathetic fight or flight nervous system to turn on, which increases inflammation in the body and then increases anxiety. So anxiety is different. Anxiety is really a natural signal from the world that is our body's reaction to what's happening around us. And anxiety is not good or bad. We think about it as bad all the time, just like we think about stress as bad, but stress is a growth opportunity. So that's perspective shift number 1. Perspective shift number 2 from neuroscience is that anxiety is a signal that's not good or bad. It's just signaling, hey, there's something in the environment that's asking for your attention, right? And so the anxiety can be thought of as directly proportionate to where like how much attention we're giving to things that we don't have control over. So if there's lots of things going on around us, like the news, too many work responsibilities, what other people might think about us, and that's what we're focusing on, well, we don't have control over those things. So anxiety is triggered by uncertainty and feeling out of control. And so there's a directly proportionate relationship between how much time we spend thinking about things we don't have control over and how much anxiety we have. So if we are spending 50% of the time thinking about past regrets, as one example, right, which many of us have been trained to do, we can't change the past. So thinking about past regrets for 50% of the time means that we're going to feel more out of control 50% of the time. And that's going to increase our anxiety 50% of the time. And if we then say, okay, I notice I'm spending 50% of my time thinking about the past and I don't have control over that, so I'm just going to let the past be the past. I'm going to learn from what lessons I can from it, and then bring myself back to the present through my breath, through gratitude, through soothing touch, through any of these natural techniques that bring us our center of our minds back into our bodies, then what happens is you've regained attention control. And the more time you spend putting your attention on things you can control, then the more in control you feel, the more uncertainty you've eliminated from your consciousness, and then the less anxiety you have. Does that make sense?
It makes sense. Um, everyone gets triggered in different ways. Everyone has, and but also, some people seem to be better at managing emotions, managing stress. Why is that? Is that a skill, or is it simply wiring, the way that we were just born, and everybody's wired differently? You know, what's the difference, like in that? What would you say?
So it's both, but it's not wiring per se. It's more about past experiences that have made us feel unsafe. So a trigger is when you have an experience in the present. You're having an experience like right now that reminds you of being in danger in the past.
Right.
And then rather than being with the present experience and asking the question, am I really in danger right now? And then putting it to the test, we just go back to the past and allow the past to control our perception of the present. So it creates a filter, like a lens on your glasses that you're looking through that says, this reminds me of danger from the past, so I must be in danger right now.
Right.
And so that is what a trigger is. And so the trigger response is under our control. So what we're not under control of, what some people think of as wiring, is actually the memory of past traumatic events that can be from experiences that we've had that we remember or don't remember, or it can be from experiences our family has passed down to us and through epigenetic code. And what we have control over is not that. What we have control over is, what do we do as a response when we experience a triggering event? And so that's a skill. That's a skill that's highly trainable by any human. And we all are born with the ability to train that skill. And that skill is called adaptability. And that we have entire regions of our brain that are evolved to adapt and to train this skill. And one of the major adaptation pieces that we should teach better, that we don't, that neuroscience strongly supports, is this idea that when you experience something that reminds you of a past traumatic or dangerous situation, maybe from childhood, that you might have felt threatened in the past, that rather than just going to that situation, you put it through a test, a thought test that says, is this actually true and useful to me, this triggering of the past? Is this actually consistent with what's happening right now, or is it just bringing up the memory because something about it is similar to the past? And then as you start to, this is called thought questioning, which comes from cognitive behavioral therapy. And as you learn the skill of questioning your thoughts, then you regain control of your attention and bring yourself back to the present. And then you are accelerating your ability to adapt by not allowing the trigger to take hold. Does that make sense?
Yeah, but sometimes those triggers are automatic, and
The triggers are always automatic.
and sometimes the emotion that comes after you are triggered can be quite overwhelming. That even if you start questioning your thoughts, you're already in the middle of the tsunami, in a way, right? So and I was curious, like, what do you do then? But in order to answer that question, like, I'm just gonna pick up common trigger that a lot of people have. Like, let's use like public speaking as an example. Let's say, okay, when
most common fear.
It's a common fear. So let's say that, when I was a kid and I was 12 or 13 or 15, whatever, I had a bad experience in school, and the professor called me out, and then I had an embarrassing moment where I didn't know the answer, or I was meant to do a presentation and I failed miserably. So you have the bad memory already, and now as an adult you're at work, and then you have to do a talk or you have to do a keynote speech or whatever, and then you start feeling very fearful. So let's use that. And I know, and I've been following your work, Dave, and you talk a lot about training the nervous system to feel safe. So walk us through how would training the nervous system and questioning your thoughts, like both scientifically and practically, how would that look like in this scenario if you had this fear or these
Yeah,
triggers?
and this is like one of the most common fears. This is a great example. And when people are surveyed around public speaking fear, people in general across the board in surveys report that they fear public speaking more than death. So think about how much fear there is around learned fear there is around public speaking, right? And embarrassment in public. So
Embarrassment, yeah, that's
it's
true.
huge, right?
Why would I've seen so many people uh, project such confidence speaking in public, and I wonder, are they wired differently? Do they are they really fearless, or are they really well trained actors?
Yeah, it's all training. So the good news is it's all training, which means any of us can train ourselves to do it. The trick is to understand what's happening in the brain and that all of it's learned behavior. So if you think about take yourself back to your childhood experience where you might be in school and you might have messed up a presentation and you're publicly embarrassed or shamed. And then the core fear that gets triggered is exclusion from your community, right? It's people are making fun of me, laughing at me, I'm embarrassed, and then you're afraid because people might they might like separate you from your community because they're going to think about you differently because you messed up, right?
Right.
So that fear gets stored in your brain in the amygdala called the fear center and your emotional cortex, which is deep on the inside of the underside of the brain called the limbic system, which stores all our emotional memories and experiences. And what happens is there's a direct connection that forms when you have that experience as a young person or any time in your life where there's a connection formed between the act of public speaking, the fear of the emotional experience of being excluded from your community, and because you mess up, and the fear center of the brain, the amygdala, and those wire together very tightly, which is what happens when you learn anything. But in this case, that's what happens when you learn fear around a public speaking experience.
Right.
So that's what happened in the past. So then you're presented with an opportunity to do a keynote as an adult, and you're up on stage and you start to sweat and you start to have racing thoughts and your heart rate goes up and you start breathing fast because what happens is you're, rather than being in the moment with just presenting what you know how to talk about in any other one-on-one situation, your brain is activating that past learn loop. And that past learn loop is public speaking directly connected to the emotional memory of the embarrassment, directly connected to the fear center, and that loop just starts to fire off on repeat. And so that is a learned fear response. It's trained. And Eric Kandel won the Nobel Prize in 2000 for discovering how we learn and remember things around fear and safety. And what was so fascinating about his discovery was that it doesn't just stop at humans. All animals going back 300 million years to ancient sea snails learn about fear and safety the same way as we do.
Hmm.
And so,
Fascinating.
yeah, it's incredibly fascinaning.
Yeah.
And so what he's shown, and what was shown by many other brilliant scientists over the last 100 years, is that the way you untrain or unlearn that fear loop around anything like public speaking is you relearn safety around public speaking. And so if you can surround yourself by thoughts, feelings, and situations that remind you that you're actually safe, there's actually no threat in this moment, then rather than going down that old loop, which isn't helping or serving us, we can recreate a new pathway that reminds us, hey, I'm just here to talk about what I'm here to talk about. I've talked about this 1,000 times before. That's why they asked me to speak. So rather than thinking about messing up, and which is a past memory, I'm going to think about just doing what I'm here to do. And as soon as you redirect resources in your brain, your attention, from the past into the present of just doing what you're here to do, which is to talk about what you know how to talk about, then you start to remind yourself you're safe and you untrain the fear loop. And so you can do that with lots of different techniques: deep breathing, mindfulness based approaches, yoga, stretching, soothing touch, hugs. I had fear of public speaking many years ago from a childhood experience like what you just described. And I used Apollo as a way to calm my body when I was on stage. And within 3 to 5 speaking engagements, I was able to redirect my attention to just being present and speaking about what I was here to speak about. And it completely transformed my public speaking ability to one where people see me and they're like, oh, this guy is so confident, he knows exactly what he's talking about, because I'm just doing what I'm here to do and I'm not thinking about the past when I'm doing something in the present moment. So it's just about relearning safety, and then your brain creates a new loop, which is, rather than public speaking going directly to your fear center in your amygdala, the public speaking experience triggers the safety response in your emotional brain. And then that becomes, as you train that loop, then the safety connections become stronger and more tightly wired than the fear connections. And you can apply this to any past difficult event that is triggering for people. And that's how you retrain the brain. And that's the entire basis of cognitive behavioral therapy.
Right. And how hard is to rewire, retrain? Because sometimes when you get triggered by, especially if it's a hard, like a difficult memory, something that was painful in the past, whenever you get triggered by a similar event, you mentioned that sometimes it just happens, in a second. Those you're not even thinking about, but just the being exposed to something generates a trigger, and then you start feeling these strong feelings. Sometimes these feelings can be potentially overwhelming, and then once you're inside this, tsunami of emotions, then it's hard to train or practice what you're sharing in the moment. So how hard it is, and then as a follow-up question is this rewiring, reframing of stress or anxiety only effective for mild, moderate forms of anxiety, or can it also help in more severe cases?
So to answer your last question first, it works for all cases. And in cognitive behavioral therapy, which is one of the most well-regarded techniques for how to train your brain and your body to respond differently to these triggers, it is called exposure therapy. So you're just re-exposing yourself to the same situation or a similar situation that you were in the past that caused you to be afraid and taught you to be afraid. Now you're surrounding yourself with the same public speaking experience, but have a lot of reminders around you that you're not in danger. And like it could be in therapy, we'll have a therapist there, and the therapist will be like, I'm here, I'm with you, so you know you're safe, right? And the patient will say, yes, I know I'm safe. And then you will say, okay, go present, right? Go present something to me. And then they'll present, and they know they're safe. And then they do it. Maybe their fear response is triggered a little bit. And then they do it. They do a 5-minute presentation, and they say, okay, now do it again. I'm going to hold your hand, right? Or do it again, and after doing like 3 minutes of deep breathing. And what it does is it just reframe. It's like a reframe, but it's more the idea of what is the internal state of the body, and acknowledging that internal state, and right now, not the state of the past. So again, we can't change the past. The past happened. It's past. We can't change it. What we can change is how the imprint of the past shapes our sense of self. And so the good news is that it's easier to train yourself out of the fear response than it was to get into the fear response. It's less painful to train yourself to feel safe again by just bringing yourself back to your body and noticing what's going on in your body, if you're taught how to do it properly, than it is to go through that fearful experience again. The trick is it takes practice. Everything comes with practice and training. So you have to repeat it over and over again. And as you repeat it, you're strengthening those neural loops in the brain around public speaking and safety, or rather than fear. And the way to understand that is to just like slow the process down. So what is a trigger, right? A trigger, if we say a trigger just immediately brings me back to this experience, and then I have this tsunami of emotions and thoughts, and then I'm just back there acting as if I was back there, then we've skipped over a lot of what the trigger is really triggering. A triggering moment is a moment where a past memory is remembered, that where fear or lack of safety existed, and that brings up a whole bunch of emotions, right? Feelings. And those feelings live in our body. And so if we skip over feeling the feelings, then we go straight back into the past as if we're there right now. But we're not in the past right now. It's not the same situation, right? It's a different situation now than in the past. And so if we go back to the past, we will, and stay there as if it's true and we're there right now, we will relive the past experience and recreate the past pain of that experience. So the trick is to slow everything down and just feel the feelings that come up from the triggering event. And what happens is when you feel those feelings, as uncomfortable as they might feel, like the feelings of, oh, I was embarrassed in the past, or I was afraid in the past, or because I wasn't prepared enough, or any of those things, then you just sit with those feelings for a moment. Usually it's 60 seconds, 90 seconds. That's all it takes. It's just closing your eyes and just feeling what's going on in your body. And then those feelings, after about 60 or 90 seconds, will tell you what is going on. And when you feel your feelings will signal to you, because emotions are signals. They're not good or bad. They're just signals, just like anxiety. And so when you feel those feelings, they signal to you, oh, I'm feeling this feeling because when I was a kid, I had a challenging public speaking experience. And then you start to go down the line of thinking, well, I'm not a kid anymore, and I have had way more experience than I did back then. And I know I can do this better now than I did back then because I've done it so many times and I know what I'm talking about, and that's why they asked me to be here. And then you start to be able to help yourself ground in your body of, oh, these are emotions from the past. They're not actually related to what's happening right now. It's just a memory. And then you can step out of that memory, leave the memory in the past, and then come back to the present. And the body is always in the present. Our minds can be anywhere. Our minds can be in the past, they can be in the future, they could be in some other planet or someone else's brain, but our bodies are always here. And so that's why the best techniques for public speaking are breathing, soothing touch, soothing music, meditation, mindfulness, yoga, and tools like Apollo that work to give you the benefits of soothing touch. Public speaking anxiety being one of the main reasons why people use this technology, because it helps it centers your mind from anywhere else it could be back into your body and reminds you you're safe right now. As soon as you know you're safe to feel your emotions, you know you're safe to speak, right? And then it just centers everything and aligns everything together. Does that make sense?
Makes sense. Makes total sense. Do you still feel stress or anxiety when you have to give a public presentation?
Not at all. No, I actually love it.
That's great. That's great. So let's talk about Apollo. Let's talk about Apollo Neuro. I think it's a fantastic innovation, and I wanted to ask you, like, what was your original aha moment? That sparked the idea for this product, and how did you take it from the lab to a consumer product?
So it was really studying safety and fear learning, and I've been studying in studying chronic stress for 20 years. I started in the lab looking at cells and human cells in a dish, and then moved to whole humans in about 2011, 2012, and started to think about, through reading a lot of neuroscience papers that had come out on trauma, that, and Eric Kandel's work, of course, that that trauma is a fear learning experience. And in every single animal and every single human study of how you fix learned fear, you have to relearn safety. And when you relearn safety, whether you're an animal or you're a human, we can repair learned fear and remediate it, and basically what's called extinguish it from our consciousness, which is pretty powerful. And that encoding is not just happening in our neurons that are in our fear center of our brain, but also all the way down to the epigenetic code that regulates gene expression of stress response genes like cortisol. So I was studying this and noticing in the clinic when I was treating veterans and women with severe trauma that they were not getting better with the medication-only based treatments that we were taught to use in the clinic, that the medications were symptom-based approaches, but they were like numbing people to their symptoms of fear, but they weren't actually getting to the relearning safety piece. They were skipping over the relearning safety piece. And so people weren't getting better. They were just getting more numb to their fear. And so as I started to understand that, and that the medications were showing they weren't working in 70+% of people with PTSD, I started to look at other techniques that start to relearn safety. And so I looked at breath work, meditation, mindfulness, yoga, soothing touch, soothing music, all soothing sensations help us relearn safety. And that was really interesting. And then I found MDMA-assisted therapy, which is the leading treatment now in trials for PTSD. And it flips the script on the way we treat PTSD because, and I'm one of the few psychiatrists in the country who's trained in both MDMA and ketamine-assisted therapy. And so I was studying how these techniques work. And I was trained in MDMA therapy in 2016. And during that training, I had already learned many different kinds of psychotherapy, and they were all safety-based. They were all about safety relearning. And I would read Eric Kandel's work. It was all about relearning safety to extinguish fear. And then I did my MDMA training, and I was studying how MDMA works, and this light bulb went off that was like, oh, this entire training around MDMA is based on accelerating or catalyzing the safety learning pathways in the brain. And that MDMA works by amplifying safety cascades in the emotional brain that starts with the safety of patient trusting the therapist and feeling safe around the therapist. And when the patient feels safe around the therapist and trusts the therapist or multiple therapists, they learn to remember what trust feels like and feeling safe enough to trust. And then they can learn to trust themselves. And MDMA is like throwing extra rocket fuel on that circuitry that amplifies the firing of those safety neurons that accelerates safety learning. And then people feel safe enough, even with the worst traumas ever, they feel safe enough to remake meaning around those past traumatic events. And when I saw that safety started to come out in every single area, the safety neurocircuitry was popping out in every single area I was studying with MDMA, with breath work, with biofeedback, with all these techniques, vagal nerve stimulation, I realized that we're missing the mark and that we need to understand safety better and how to deliver safe signals to the body. So we went back to the lab and we started trying to figure out how to use sound waves that you feel on your body through Apollo, like what I'm wearing on my chest now, or through your phone, or through anything that vibrates on your body, how to use sound waves to remind the body that it's safe. And that ultimately we actually discovered through that study of the neural pathways that activate safety through soothing touch, we discovered through the pathways that were already understood how to use sound that you feel through your skin. So like low frequency sound waves, like what comes out of a subwoofer, that could actually remind the body that it's safe. Just like MDMA, just like somebody holding your hand on a bad day or giving you a hug. And when we saw the same responses in the body in all of those situations and with these sound waves, we realized that we were getting close to something. And then we put that through a bunch of double-blind, randomized, placebo-controlled crossover studies at the University of Pittsburgh Medical Center. And we were able to see that these specific vibration patterns, unlike other vibrations that come out of your cell phone or come out of other massagers or vibrating things in your life, these specific vibrations that are layered to go up and down very slowly can actually increase vagal nerve activity and safety responses in the body. And when we saw that, we knew that we were onto something. And so that became the origin of the technology from the research. And then we started the early commercialization process at the University of Pittsburgh. And ultimately, we had the opportunity to raise some early funding. My wife and co-founder at the time, she was Catherine. She was just helping us out to get university funding, and she was able to help us bring in like $500,000 in early funding. And then we built prototypes, distributed them to 3,000 people. We started wearing them and using them in addition to using them in trials, and it changed our lives. Like, we slept more deeply at night, we focused better during the day, we were just more of ourselves more of the time, because we were like the layer of fear and stress was eliminated or minimized. And so when we saw that effect on ourselves, we realized, okay, we have to commercialize this product for everyone. And so in 2020, after doing thousands and thousands of people worth of testing and many clinical trials, we released it into the world as a consumer wearable product. And now anybody who has an iPhone who's listening can actually try it. You can just download the Apollo Neuro app on your iPhone, and it's free. And you can feel the unique vibrations that we've discovered through your phone and experience the benefits for yourself in minutes.
So is the product a mobile app, or is it a wearable that you have that you put on around your wrists, or what is the actual product?
Well, the product is both. So the
Both.
product is a software platform at its core. The software platform generates the vibration patterns, and the vibration patterns can be delivered like songs that are composed for your body through your iPhone to your body, or through this little guy. And this wearable you can wear anywhere on your body. So I was wearing it with a clip on my chest. I just snap the clip in, and then I just throw it on here, and then it vibrates gently, barely noticeable, but enough that it regulates my nervous system to remind me that I'm safe and that I don't have anything to worry about when I'm doing something like talking to you or giving a huge talk on stage or whatever it might be that might stress me out, being stuck in traffic late for a meeting, right? Like, all of those kinds of situations trigger our stress response when it's not meant to be triggered. The stress response is meant to be triggered when we're under survival threat. So we have two forms of the tool, one of which is a mobile app that, again, anybody can try for free by just downloading it to your iPhone. The other is the wearable that gives you the benefits of the vibration throughout the day and night.
Right, fascinating. I'm gonna try it for sure. And we have just one more minute before we go, but I wanted to ask you, like, what do we need to know about psychedelics and MDMA assisted therapy? Is it for certain type of patients or conditions only, like severe PTSD, or do you think these treatments will become part of the mainstream mental health care?
Well, we're working as a field to usher them in as more mainstream mental health, and also mental wellness. So not just to treat severe mental illness like PTSD and depression, which is what they're primarily studied for right now, but to actually be used preventatively. So to prevent people from, when they start to have symptoms of burnout or chronic stress, to actually intervene early and prevent them from being diagnosed with mental illness down the road. I think the main way to understand psychedelic medicine is to understand it in the historical context of medicine as a field. So right now, mental illness is not taught that it can be cured, right? When you're diagnosed with a mental illness, we are taught to tell you as doctors that we can treat it, and by giving you medicine or therapy for life, but we are not taught to use the cure word, to say, you do these things and you won't have symptoms anymore, right? Like, we don't talk about mental illness that way. So even the studies that much of the pharmaceutical companies and the universities have done show that if you stop taking your antidepressants, most people relapse into depression, right? So that is kind of where we're at with mental illness as a whole, regardless of the diagnosis. You stop taking your medicine, you'll become symptomatic again. So There are another set of illnesses in the past that also used to be like this, where when you were diagnosed with them, it was considered a lifelong and often fatal illness. And those are called infections. So back in the 1920s, 1930s, and 40s, before antibiotics were mainstream, when Alexander Fleming developed them and discovered penicillin, disorders like syphilis and many other infections were considered to be fatal or lifelong illnesses that dramatically shortened human lifespan. There was no cure for infection in most cases. We didn't talk about cures for infection very much. It wasn't really a thing. All of a sudden, Alexander Fleming discovers penicillin. Then we start treating people with penicillin, which is a bread mold. And within 20 to 30 years, infection goes from a fatal or terminal lifelong illness to one that can be cured within 1 to 12 weeks. One of the greatest discoveries of all time in medicine, extending human life by 10 to 30 years, right? And Nobel Prize-worthy discovery. Now we're at the similar stage with mental illness in the current 21st century paradigm, where mental illness is considered incurable. It's treatable, but incurable. You have it for life. It's often fatal. It often results in people taking their own lives or being sick for life. And it's considered to be basically, for all intents and purposes, a terminal illness. Introduce MDMA-assisted therapy, and I'm just speaking from the data from the phase 3 and phase 2 trials. What we see is from just 3 doses of MDMA-assisted therapy with 12 weeks and 42 hours of psychotherapy over 12 weeks with 2 therapists with a very specific protocol, we see that over 50% of those people with over 17 years on average of PTSD from the phase 2 trial, over 50% of those people are no longer meeting diagnostic criteria for PTSD at 2 months after the treatment has ended, with just 3 doses of medicine, not everyday dosing, just 3 doses, right? 55% are no longer meeting diagnostic criteria for PTSD. Fast forward 1 year out, that number goes up from 55% to 67% without any additional treatment. So people continue to get better after the therapy has stopped. And that is an antibiotic level effect for mental illness. We have never seen anything like that effect in the history of psychiatry for mental illness. And psychedelic medicines with therapy, not just by themselves, but with therapy, are really bridging the gap to help us develop what I would call antibiotics for mental illness. And that is the future that we're really looking forward to. And it makes this time in psychiatry, like the present, right now in psychiatry, easily the most exciting time in the history of our field, because within the next 5 to 10 years, rather than you going to your doctor and saying, I'm depressed, and they give you pills for life and therapy for life, you go to your doctor, they do some regular interviews on you, they collect some biological samples, and then they hand you a prescription to remission, which says, do these 6 to 12 doses of ketamine with therapy, and you have a 90+% chance of no longer having symptoms for life within a year. Or do this 3 doses of MDMA and 12 weeks of therapy, and you have a 90 whatever percent chance of no longer being symptomatic at, this much time. And that is really what is most exciting about psychedelics. And I think most people really don't understand, because most people don't know history of medicine. But if you understand the history of medicine, you can really understand how paradigm shifting these discoveries around psychedelic therapy really are, and how they're going to change everything about the way that we treat and even think about mental illness. And we should all be behind that, because if we can get behind that and support it as a community, then we can get this out to people more quickly and in a safer way. And if we can do that, we can actually maybe start to see the rates of mental illness start to drop year over year rather than going up exponentially year over year. And wouldn't that be great?
Yeah, it's fascinating indeed. Fascinating indeed. I know that we are over time now, and we have to go. But but Dave, I thank you so much for your work. I think you are having a great impact on humanity, and thank you for your time, and thank you for sharing your wisdom today.
It's absolutely my pleasure. Thank you so much for having me.
Until the next time, and thank you everyone for watching and listening. Thank you.